I'm Trish, and today I'm going to show you how to apply fluoride in trays. So you have two choices that you can have. We have the neutral pH, which is typically for crowns or people with composites or a lot of restorative work. And then we have the acidulated phosphated fluoride, and that is for more of like virgin teeth. Then we can look at the different size trays. The yellow is typically for a child. The white is typically for a mixed dentition or someone with a very small mouth. And the blue is for an adult. So today I have Chrissy with me. So I know that she has crowns and she has some composites. So we're going to use the neutral pH. And we will start. We're going to do a small ribbon all the way around. Okay. And if you wanted, you could just hit it on the table a little. It spreads it out. So before I do the fluoride treatment, I want to make sure that Chrissy's teeth are clean of biofilm. Usually we do the fluoride treatment after cleaning, so our teeth would be clean, but if not, we would use a toothbrush and remove all the biofilm before we do anything. And then we want to explain to the patient what we're about to do. So Chrissy, I'm going to put this in your mouth. I'm going to dry all your teeth first. Okay? And I'll put it in kind of like a mouth guard. We'll put the bottom in first, and we'll do the top. Then I'll just have you open a little bit, and I'll put the suction right in. So you don't want to swallow any of the fluoride if possible. And then once I put that suction in, I want you to kind of tilt your head forward a little bit so you're not swallowing any, okay? Okay. All right, so the first step is, and you want your patient to be seated upright. Alright, so I'm going to dry the teeth off, okay? I'm going to do the bottom first. You want to make sure it's nice and dry. And then we'll do the top. Okay, I'm going to put the bottom in. And the top. Taking the lips over. Okay, stay open. I'm going to put the suction right in. Open for you, Chrissy. Okay. And close. And then I want you to make a chewing motion, okay? Tilt forward. Great, and I'll have you hold the suction. So, before I do this, I want to inform the patient that this is going to be a 4-minute procedure, because it does take a long time, and it's good for patients to know what they're going to be doing. For 4 minutes is a long time. So, for time's sake, we're not going to do 4 minutes today. We'll do 1 minute, and she is on the clock. I do see the clock right there. So you're just going to make a chewing motion, Chrissy. Good. And I also want to inform the patient why I'm doing the fluoride procedure. Usually we do this before we do the fluoride. For time's sake, I'm doing it while she has the fluoride in her mouth. So Chrissy, the fluoride is really important in protecting your teeth. It's a prevention against decay, especially if you're at high risk for decay. Okay. And you never want to leave your patient at any point during this 4 minutes. You doing okay, Chrissy? Great. Okay, so it hasn't been quite a minute yet, but I am going to let Chrissy, I'm going to take that out of Chrissy's mouth. I am going to give her a paper towel, because usually when you take it out, you do get some saliva out. So I'm going to take this out for a second, okay? And then I will take this out. And then I want you to put the suction right back in. There we go. Very good. Alright. And I'm going to let her get all the rest of the fluoride out of her mouth. Does that feel okay? Alright. So after the fluoride's done, you want to make sure the patient knows that they're not supposed to eat or drink for half an hour. Okay? And that's how you apply a fluoride treatment.